Hi everyone, I am Eric Van Horn, the Chief Business Officer and one of the first employees here at Landmark. My job is to grow our business. So you may be asking yourself, who are the Landmark customers? Good question. Any health plan or health system that has risk for patients is who we can work with. Effectively, the sickest of the sick patients, those most vulnerable, are going to end up in their plan, in their system. And a lot of times, these customers of ours don't know how to take care of these patients. They're just not set up for that. And it's in large part, as you well know, because these are the types of patients that don't know how to navigate the system. They don't have the resources to get to the doctor. They don't feel well a lot of the times, and maybe their physician isn't available to them, so their only recourse is to dial 911. And we have therefore a golden opportunity to provide care to them in their place of residence so that they don't have to dial 911, but rather they can call us. So health plans and healthcare systems who have risk, again, are looking for solutions, and Landmark can be that solution. Did you know that 5% of their patient base usually takes up 40% of their total costs? And because of all the regulations that have come down with the Affordable Care Act, and before that the Medicare Modernization Act, and then all of the pressures that employers are putting on health plans and health systems to control costs, to remove unnecessary services, to improve quality. In the Affordable Care Act, there's regulations that now penalize health plans if they don't provide high quality care. And then on top of that, there's such an influx of people into Medicaid programs in most of the states across the country. Health plans and health systems in general are saying, I need help. And that provides a golden opportunity for Landmark to provide that help. Because our mission and our vision is to be available to these sick patients whenever they need us, wherever they reside. And we've built a system to do that. So as part of our pitch, we explain what we can do for them, how we build medical groups that are available to our patients, that we integrate care between medical, behavioral, social, pharmacological, dietary services, that we coordinate care with their primary care physician and don't take over that care, but rather better coordinate between the patient, their provider, their family, their caregiver. And all of that makes a lot of sense to these health plans and health systems that need a solution for this service. Let's imagine a patient that's not part of the Landmark program, and they're not feeling too well. They can't get a hold of their provider, or it's at a time of day where their office is closed, the provider's office is closed. What do? They likely will dial 911. So if you're complex and chronically ill and you dial 911, an ambulance is going to come, take you to the emergency room, or you're going to drive yourself, or someone's going to drive you to the emergency room, and you're going to present to the emergency department. Because you're complex and chronically ill, you're very likely, 80 to 90% of the time we find, you're going to get admitted to the hospital. The average cost of an inpatient hospital admission is $15,000. Could be less. A lot of times it's higher, but it's averaged at $15,000. So by presenting in the emergency department and dialing that 911, minimum cost $15,000. On top of that, you're going to have consultants or specialists that need to check in on you and then likely want to see you in their office after you've been discharged. So probably 3 to 4 consultants that are checking up on whatever ails you. By definition, in the Landmark program, you have a lot of chronic conditions, so there's a lot of specialists that will glom onto that case. 30 to 35% of the people that go into the hospital that qualify for our program end up in a subacute setting. So that's another $10,000 bill. So we're at $15,000 for inpatient, $10,000 for subacute, probably another $1,000 for specialist visits. Then you have pharmacological costs, other types of services that are required, x-rays, labs, what have you. It's about $30,000 of unnecessary spend just because that patient didn't have any other recourse but to dial 911. Now comes along Landmark, and instead of 911, they can call Go Landmark, whatever our phone number is. And by that, we will provide services to them in their place of residence, get them hydrated, give them the appropriate medicine, calm them down, coordinate their care. If they do need to go to the emergency room, that's where they need to go. But for the most part, we're able to avoid those unnecessary services. So you may be asking yourself, what does growth really mean to me? Well, let me explain it this way. When we establish a relationship with a new partner, we land in that geography and we build up our medical group and we start treating the patients that have been assigned to us and qualify for our program. But then what we also do is we expand that relationship and we expand our breadth within that territory. So other health plans see what we're doing for one health plan and want to work with us on their sickest of sick patients. And then those particular plan partners want us to not only treat those patients, but also in their home, but maybe also round on them in a subacute setting or launch a new product with them, which is what some of our plans are asking us to do, or treat other patients that might need episodic care within their home for a shorter period of time. So we land somewhere and then we expand in that same territory. So that also creates a lot of new job opportunities. It creates synergies, efficiencies, effectiveness of the team. And it really allows us to start impacting the healthcare of the communities that we serve, which is something that's true to our heart and definitely a big part of our mission. The health plans and the health systems, they get to understand that. They see that we have demonstrated this in many different places in the country with those in the Medicare Advantage space, Medicaid patients, duals patients, those with Medicare and Medicaid eligibility, and then even in the commercial exchange space. And so we're a solution that can help them in many different ways. So what does that do? Well, that allows us to grow. And in 4 short years, we've been able to establish relationships with 12 different partners in 13 different states, and we're accountable for almost 80,000 chronically ill, complex patients. So when you go back and think about the $30,000 per patient and 80,000 patients, that means Landmark is effectively accountable for $2.5 billion in spend. Remember when I spoke of 5% of the patients make up 40% of the cost? In Medicare alone, that's almost $500 billion in spend just on 5% of the people. So by us having this opportunity to take care of these people, to accomplish our vision, which is to transform healthcare, which these are the patients that need healthcare the most, we're able to reduce unnecessary services so that $2.5 billion comes down to a much smaller amount. Improve quality of healthcare. We generally get our patients up to the highest level of the ratings that are used to grade both health plans and healthcare systems. Improve patient satisfaction. Our net promoter score is consistently in the 90s. Did you know that Amazon is less than that? Apple is less than that, and we are 3 to 5 times greater than any other health plan. So our patients are satisfied. They get access to high quality health care when they need it in their place of residence where they're most comfortable, and we're reducing costs substantially. So the world is our oyster. We have all kinds of growth opportunities, and when we sign up new health plan clients and therefore treat more patients, what that does is it creates more jobs, it creates more job opportunities, and it just is really a momentum that we're very excited about. to come join the family and help us treat all these patients and do what you went to medical school or nursing school to do. It's a great place to work. It's very innovative. We really encourage people to come to us with all kinds of ideas, and it's a dynamic place that you got to be at. So thanks a lot.